Department of Nursing Regional Institute of Medical Science Hospital Imphal na Sinduna Nongmagi OIBA nursing training program ama PANGTHOKKHRE. First responder in patient care haiba teamda neuro intensive care unit RIMS ta PANGTHOKKIBA training program aduna nursing na masagi mathauda hena mapung fahanba mating oigani hairi program aduda Professor G Sunil Kumar Sharma Director RIMS na chief guest, Professor N Sanjeev Singh Medical Superintendent RIMS President, Professor L Rajesh Singh Dean Academics amadi and Imphal Chief Nursing Officer RIMS na guest of honor oina saruk yaki. Thauranga mari leinana Professor G Sunil Kumar Sharma na phongdokhibada nursing asi patient care gi oina first responder ni makhoi sing asi irai laiba profession ama natte tamsiliba makhai adumak hena patient singi seba ningthina tawba ngamgani toina training program sing asinba asina hena makhoida knowledge hengat hangani haibana chingba wafam sing thamki training program aduda expert singna tongan ba hiramda sugaina wafam kaya thamki loshilapda training saruk yariba participants amadi resources person singda appreciation certificate singsu khusinaki.
Contingent nurses have gone to RML hospital for a 5 days training course in advanced training in trauma and burns also. And once they come there, we should also have another training session so that we can further expand or give this information to everyone. But as you all know how we run a hospital, we have doctors, we have different staffs, but the first responder is always our nurses. And at the very outset, I would like to congratulate the organizing team for this very good event. Nursing is not merely a profession, it is a commitment to service, compassion, resilience and excellence. As first responders, nurses are required to combine clinical competence with presence of mind, empathy and swift decision making. Whether it is identifying early warning signs, initiating immediate care or coordinating with the medical team, your actions often make a difference between deterioration and recovery. In today's rapidly evolving healthcare environment, continuous learning is no longer optional, but it is essential. Programs like continuous nursing education help bridge the gap within the knowledge and fact, reinforce critical skills and empowers nurses to deliver safe, efficient and evidence-based care. I am confident that today's training will further strengthen our nursing force and give one of the best service in the entire state. RIMS Imphal has always stood for excellence in healthcare, education and research. The nursing workforce is a backbone of this institution and I deeply appreciate your dedication, discipline and tireless service often